Hi, I'm Dr. Joe Kennedy, and today's Medical Minute is about tips to manage your back pain. What I would say is if you're having really bad back pain, a sudden onset of back pain, I would say the first thing you want to do is relative rest. So you don't go to bed rest, but you have to sort of take it easy. We call it relative rest. You're still active, you're still moving around. The other thing you can use is ice. Just like if you sprain your ankle and you have swelling, when you strain your back, you often have swelling, and you can use ice to your back for that. And the other thing that we like to really encourage is movement. We have a saying here that motion is lotion, and that if you move around, that helps to get your body to heal. You can stay down for short periods of time, but I recommend about every 15 minutes during the day that you'd get up and do a little bit of walking. And then once a day, you would do a 30-minute walk, if you can tolerate that, just to work towards that 150 minutes a week of walking, which has been found to be very helpful in overcoming back pain. Use a gentle stretch and also experiment with the stretches that seem to give you relief, and avoid ones that provoke your pain. You want to do something that either immediately or in the short term after you feel some relief of the muscles. The research indicates that there's a strong connection between smoking and back pain, and that if people stop smoking, they reduce their risk of back pain, and they also have found to get better faster when they do have pain episodes. Sometimes as an adjunct to the self-care strategies of relative rest, ice, and movement, you can use some over-the-counter medications such as Tylenol, which is an analgesic or a pain medication, and or ibuprofen or Motrin, which is classified as an NSAID, which is more of an anti-inflammatory. All of these have to be used with caution, and also advise informing your primary care provider that if you're going to be using a medication like this. They're mostly safe, but in some cases people have to be very cautious depending on other health conditions. But they can help. The other caution I give patients when they're using pain medicine of any kind is that if it masks the pain too much, it may allow you to do more than you should and can further the injury. So you have to be very careful in using any kind of pain medicine when you're trying to recover from back pain. Thank you for watching this Medical Minute, and we hope this helps you manage your back pain, but we're here if you need us at Tanana Chiefs.